Hi, my name's Lee. I'm a trust associate with the Concord Hospital Trust. And today we're welcoming you to What's Up, Doc? The Trust would like to recognize and thank the Walker Lecture Series for their sponsorship of What's Up, Doc? The lecture series offers a wide variety of programs on history, art, and science, as well as dramatic, musical, and literary performances. All events are free to the public and held at the Concord City Auditorium. We encourage you to check out their website at walkerlecture.org to view their calendar of programs. Today we're welcoming Dr. Jason Lindner. He graduated from Saba University School of Medicine and is currently a third-year physician with the New Hampshire Dartmouth Family Medicine Residency at the Concord Hospital Family Health Center. He has a long history with our hospital from before medical school, and we're happy to announce he'll be joining the hospitalist practice following his residency. In his free time, he enjoys hiking, exploring the White Mountains, and anything outdoors. We also welcome Dr. Valeris, who reached her Master's of Social Work from Boston College and her doctorate in social work from Arizona State University. She's a faculty member at the New Hampshire Dartmouth Family Medicine Residency and Leadership Preventive Medicine Residency, and works in the Behavioral Health Department at the Concord Hospital Family Health Center. Dr. Valeris is also on the Trust Healthy Beginnings Endowment Volunteer Committee. Please welcome and joining our speakers today.
I'm going to hold these so that you can hear me, and then when Dr. Lindner joins, we'll just take a moment to connect him with the microphone so that you can hear him, and he'll take it away. So I just thought I would start with giving a little bit of an overview of what residency is, rather than assuming that word is something that we use all the time here, but if you're not in medicine, you don't necessarily have the difference between what the stages of training are. So Dr. Lindner, for example, we have 24 residents, and once they graduate medical school, they have to do a number of years in the field that they want to practice in with lots of supervision, so opportunities to practice independently and have some oversight from our faculty physicians. The man of the hour, Dr. Lindner, you've already been introduced. So I'm just explaining a bit about the residency in this part of your training. So as they have lots of different experiences in all different parts of the hospital, OBGYN, hospitalist, pediatrics, but the basis of our residency is outpatient family medicine, which is right next door in the Concord Hospital Family Health Center. And part of the residency is this scholarly activity rotation. And the idea is that at some point, just like today, our residents and physicians are asked to speak about something. And usually it's something that they have a lot of passion about. And so to have the experience of removing opinion and bias from something that they're really passionate about and looking at the evidence and really critiquing some of the research around this. So there's sort of two parts to this rotation. One is the experience of learning how to do a thorough lit review and deliver it to an audience that the audience can then say, oh, I'm going to do something differently as a result of learning this. But then there's the other part, which is like time management and creating a presentation and public speaking, which are all skills that sometimes we just assume the more education you have, the better you are at these things, but actually it's worthwhile to pause and create space to learn these things. So this is the result of Dr. Lindner's sort of a capstone project where they deliver this talk to an audience over 100 people throughout Concord Hospital, and he's bringing it here to you today. So I will let him take it away.
I'm Jason Lindner. I'm originally from Richmond, Virginia. I spent a lot of time in Concord, New Hampshire before I went to medical school. I'm a non-traditional medical student. I went to med school at 40 years old. Worked here at the hospital for about 10 years before, and I'm going to be working at the hospital after. So clearly I like the area, I like the hospital. So the first thing I wanted to talk about, and Amy was talking about this a little bit, is sort of what is grand rounds in relation to residency. In residency, we get told where to be, what to do, most of our time, which in family medicine is great because we get to do a lot of different things. Grand rounds is one of these great experiences where we get to do pretty much what we want to do. We get to research something that we're very interested in and prepare a presentation for nice folks just like yourselves. This presentation was initially prepared directed towards primary care providers. I've altered it a little bit, but keep that in mind when we get into some of the research, which I promise I won't bore you with too much data. We'll go through that pretty quickly. This was geared towards people that work in clinical medicine, like doctors that work in clinical medicine. And that's what grand rounds is. So I was interested in a couple of things. One, the healing properties of nature itself. One of the reasons I love New Hampshire is we have some of the most beautiful nature in the world that I've seen. And two, we have a real problem with young adults and adolescents with depression, with behavioral health problems, and not being able to get access to it. So I thought to myself, what's something that I could review and research that might touch on both? And this is some of the data that I looked at. This is MDE is major depressive episode. And what you'll see is here in New Hampshire, we're pretty much in line with the country as far as the percentage of our kids that have major depression. Here we'll see we're doing a little bit better. This is kids that have major depression that didn't have access to care when they needed it. And this is self-reported. 59.8% self-reported in the United States of kids that experienced a major depressive episode felt like they didn't have access to care. So I thought to myself, that's pretty terrible. We consistently don't have enough beds for teens in crisis in this state, and that's sort of a problem all over the country. So what I thought about is how could I combine healing properties of nature with something that could spread awareness among primary care providers that can help kids. And I came up with wilderness therapy. Has anyone ever heard of wilderness therapy? No, a lot of people haven't, which is why I did some research on it and presented it in my grand rounds. It's what we'll get to. The first question is, how does nature actually help? Because there has been a fair amount of research that spending more time outside of environments like this and highways and more time in the woods, away from our cell phones, and sitting on a porch looking at things that are natural actually benefits multiple areas of our health, from physical to emotional. They actually say about 150 minutes a week with the cell phone off and the TV off. And that can be sitting on the porch, that can be going for a walk somewhere close to trees, that can be taking back roads, staying away from highways. This is just a beautiful scene, which is why I included it. Stress is a major obstacle to healing, and we've seen nature incorporated into healthcare in other areas. And this wasn't a big part of my grand rounds, but I wanted to include it in this. How can nature help someone's overall health profile? Thinking about exercise in the woods, exercise in rivers. Adolescents and young adults can improve their future as far as cardiac health, obviously body composition and strength. We have beautiful mountains here that people can get out into, improving their heart health, their emotional health, their risk of diabetes with any exercise goes down. This pretty much explains some of the same things. When we get into the woods, when we're exercising in general, we're producing hormones that counter hormones that are actually toxic and inflammatory to us. So any form of exercise is great, but if we can combine that with something that is enjoyable and redeeming, it can be even better. Then there's another thing with nature itself. There's this sort of intrinsic property in us where when we smell smells that are produced by trees, and that can be when smelling a flower in a room full of plants, or that can be walking through the woods, or the smell of the beach. that actually stimulates certain hormones to be released that, again, have antioxidant and anti-inflammatory effects that can improve, in addition to mental health, overall health. This is right here at Concord Hospital. We built this a number of years ago. This is right outside of our ICU. Again, incorporating nature into healthcare, it's a beautiful relationship. So now we'll get into some of what I actually presented about, and that's adding the benefits of nature to a therapeutic environment. Traditionally, when we think of behavioral health, of counseling, of therapy, we think of sitting in a room like this, talking with each other, or sitting in a room with the therapist and talking with the therapist. That doesn't work for all people. Talking about kids in crisis, we think about hospitals. We think about residential treatment centers. There's not always access for people with that, and that doesn't work for all people either. So wilderness therapy is actually a subtype of something called adventure therapy. Adventure therapy is trained therapists not in counseling rooms, not in group therapy settings, but employing their practice in practical settings while doing something physical. And that can be going for a walk in the woods, canoeing on a river, at an indoor climbing wall. And sometimes through the stress of the environment itself, it can trigger personal growth, and the therapist is there to sort of help guide that. And that's sort of the overall view of what wilderness therapy is. Some of the research that I did when I really looked at data that researched multiple programs, many programs, some of which is done right out of UNH in Durham here. They have an outdoor research center that researches these programs and publishes literature based on their findings. They found 3 components that were pretty consistent among all of the research. This is actually from New Hampshire. A lot of the pictures that I used in this are from New Hampshire. This is a picture that I took in the Southern Presidentials up in the White Mountains. So the first component is the natural world itself. Now, reflecting back to the problem with adolescents, taking a kid that's not used to challenging themselves out into the woods, it creates sort of a leveling environment. If it's going to rain, it's going to rain. You can beg the sky not to rain, but if it's going to rain, it's going to rain on you. So this creates sort of an even playing field for participants from multiple different backgrounds, and an even playing field as far as challenges go as well. Second component is the physical self, the individual's ability to realize through challenging themselves, whether it's hiking 10 miles in a mountainous terrain or paddling 12 miles on a river, that they can accomplish things that they didn't realize that they could accomplish. And there really isn't, someone can be rescued if they are injured, but there really isn't, I'm going to just quit. Like, dinner is 10 miles away. So the challenge on the physical self to accomplish things that one didn't think they could accomplish also provides a great reward for them. And this was something that participants through multiple studies reflected upon, that they felt better after some of these because they realized that they were capable of doing things that they didn't know that they were capable of doing. And then finally, the social self. This is where I went to medical school. I took pictures there. You'll notice I'm in that one. This is Saba. It's a small island in the Caribbean. It's a small volcanic island. The social self, getting a group of kids, when we're talking about wilderness therapy, we're talking about a group setting, almost a residential treatment setting that takes place in the woods. Getting a group of kids going through this type of challenging experience together under the guidance of wilderness professionals and licensed therapists, they can do nothing but bond. Whether it's bonding that this is awful and we hate it, or whether it's bonding that, I didn't think I could do that and I did it. It creates an atmosphere where social development is fostered. You have to communicate with someone. If you're in a canoe with one other person and you don't know how to talk to them, and you're going against rapids, you're going to have a hard time. So you sort of figure it out. So there's a big social component to this, that people come out of this and they say, wow, I didn't realize that I could count on other people ever. And one thing I learned is that I can count on strangers sometimes, and I've made some pretty good friends coming out of this. Again, this was geared towards physicians and family practice. Is this completely safe for my child or for my patient? There are accreditation agencies, and this is just 3 of them, that look at these programs and review them, and they do risk analysis on these programs. They make sure that these programs look at their number of injuries and make sure that if they've had injuries, they were thoroughly investigated. They make sure that they do research on outcomes. How do kids do after these programs? How do they do between the beginning and the end? So in looking for one of these wilderness programs, it would be wise to look for one that has accreditation, but there is accreditation. And this is just a little information that I found about injuries per 1,000 participants, and this is old data, first of all. We're talking like 12 plus, 14 plus years old. We'll look at this. This is basically outdoor behavioral health, and it's all the way over here. So much less injuries than things like even backpacking recreationally, certainly less than snowboarding, which appears to be the most injuries. All right, the literature review. This is probably my least favorite part of the presentation, so I butchered it. I will spare you the boring data. But I did keep a couple of the slides that basically look at some of the outcomes. I looked at about 5 different studies, and I think I kept in this for you fine folks data from 3 of them. The first one that I looked at was a qualitative review, in that there's no numbers and there's no graphs. It's basically people that have come out of these programs have been asked questions in a conversation, and then surveyors look at all of those questions and they look for similarities. And these are some of the things they found. And we already talked about the 3 big components that people found to be most profound, being the natural world, the physical self, the social self. Well, they found a connection between this, talking to participants coming out of these programs. They found that the physical challenges, that the therapy itself was much more beneficial in this rugged outdoor environment than it is sitting in a clinical room. They found that by being outside, they had an elimination of outside distractors, of friends calling, of their cell phones, of social media. They found that they came out of these programs with improved self-esteem and realizing that they had more potential than they thought they had going into these programs. And they found that they learned how to develop better relationships, both with staff and with their peers. Some of the kids going into these programs, the best relationships they ever had were doing drugs with other kids. These were healthy activities that these kids were able to bond with. And this was a pretty common theme that kids and their parents mentioned coming out of this particular study. Another one that I looked at basically looked at attachment. Has anyone ever heard of attachment? Yeah. So attachment is basically our ability, our innate ability to interact with our environment, with other people. And there's different attachment styles. Some people are guarded. I don't trust anyone. Some people want to trust, and then they get angry when they can't. So this sort of looked at attachment as a theme for measurement for kids going through these programs. One thing that we found is that people with unhealthy attachment styles are much more prone to mental health or behavioral health disorders, such as depression, anxiety, and substance use disorder. Again, I'm going to keep the results and the data very brief. They did find that symptom distress decreased, and that in a number of areas, healthy attachment habits improved through these programs. There were some other areas where there was no statistical change, but some improvement with no change is certainly better than worse or no improvement at all. And then I think the most important question that we ask anyone coming out of a therapeutic program is, do you feel better? Do you feel less distressed? and these participants on an overall basis did. This looks like it's from the same study. This was from yet another study that looked at, do these changes last over time? And these people were given basically personal inventory scales going into the programs and coming out of the programs, then again at 6 months after, and then a year after. And looking at total distress, we can see an improvement from intake to discharge that almost stayed relatively steady a year later. And certainly improvement in the caregivers, which almost lasted a year later. So just to reiterate on the basis of what I was looking for here, and this is also from the White Mountains, by the way, predominant elements that were identified as meaningful among these participants, among these kids and these young adults, were basically being in nature, getting some hands-on exposure to natural consequences. Again, going back to the rain example, if I don't pack my pack right and I get rained on and my clothes get wet, that's not a consequence that was imposed upon me by my parents. That's a natural consequence. And this is a good lesson for people that haven't had to deal with this yet and that have such an issue connecting with others, that have attachment disorder and that have problems with authority, to learn that while we think as kids sometimes all of the rules are simply for the sake of being rules, there's usually a bigger reason. And then we learn as adults, obviously, that the world has consequences whether we want it to or not. This is a couple programs that are relatively local to us. Summit Achievement is right on the border of New Hampshire and Maine. They are a partially residential program where kids will stay in a campus for 4 days a week and they'll go out into the field 3 days a week. Therapists are with them 5 of those days, 4 of the days on the campus and 1 day in the field. All 3 days in the field, there are wilderness experts trained in advanced wilderness survival. And then True North is in Vermont. It's another program. It's called a hybrid model. In the summer, they spend most of their time in the backcountry. In the winter, when it gets cold, when it gets a little more dangerous, they actually have a base camp and they'll do trekking similarly to how Summit Achievement does it. Every week or so they'll go out for a few days. Some challenges that families may have when they try to access this type of care. One, there's not a ton of it, but we've just talked about 2 that are relatively local to us. Paying for these programs. 10, 15, 20 years ago, insurance companies would not touch these programs, and that's getting better. These folks have been around for about 25 years. They used to be called denials management, now they're called Fix My Claim. And they've helped families get at least partial coverage from some of these programs, much like they would at a residential treatment center. Because these are, in essence, residential treatment centers. They don't take place in buildings. And then there's also the Sky's the Limit Fund. This organization's been around, I think, for like 15 years. It's privately funded, and they donate money to help cover a portion, sometimes a great portion, of people's tuition into these programs. How many of us have Netflix? Yeah? Has anyone seen the program? Netflix series, I know you have. We talked about it. There's another program, there's another show on Netflix called Hell Camp. And I mention these because there's a lot of media attention right now to the vulnerability of kids in teen crisis programs. And that, I think, just goes with the territory. And what I mean by that is these kids are vulnerable to going into programs where they may get abused. A kid in crisis that's been getting arrested, that's sort of been declared by society, by their parents, by their school, by the courts sometimes as liars, goes into a residential treatment center, and there happens to be a predator there, which is probably a pretty attractive field to people that prey on kids. That's a target for them, obviously. Breaking Code Silence is an organization whose chairperson is actually Paris Hilton, who went to a teen crisis program and did experience trauma and abuse, and started this as sort of a place that kids that have experienced abuse can go for help. Kids that have experienced institutional abuse. On this website, what I like so much is that they have a database of reports from kids or from their parents. So you could look up a program. You could look up Summit Achievement, for example, one of the programs that I mentioned, and you would not find them on this website at all. At least you wouldn't the last time I looked, which was a couple of months ago. But it's good. I think that the allegations probably have to be taken on an isolated fashion with a grain of salt, because it might not be the institution itself that's bad. It might be either a person that's bad, or it might be a kid that is just really, really troubled. Because anyone can go on there and place these comments. However, I think it's great to have a place that I could go and look if I wanted to send my kid and see who's been saying things about this program before I send my kid off somewhere. Now, I talked about the program. The program is actually about a residential treatment program, which is sort of, there's not a nature component at all. And actually, in the school that they talked about in the program, they advertised themselves as a therapeutic environment, though they didn't seem to have therapists. And they really wouldn't even let their kids outside at all, much less the bulk of the time. Hell Camp is more wilderness-based. This is about a guy that ran a bunch of different wilderness programs, starting with one back in Utah in the 90s and early 2000s, where a couple kids actually died. There were no therapists. They were not trained in wilderness survival or in wilderness resuscitation. These are not what I'm talking about. I'm not talking about the kinds of programs that you'll see in the show The Program or in Hell Camp. I'm talking about accredited programs with licensed therapists and certified wilderness experts. I just have to make that clear. For people that are interested in learning more about this, this is a really great podcast. It's run by a guy, I think, I've forgotten his name now, I'm sorry. It's called Stories from the Field. It's run by a guy that actually was one of the founders and still works for Summit Achievement. They interview people that work in adventure therapy. Adventure therapy can be, wilderness therapy is more of a long-term thing. It's more of a residential treatment thing. It can be a couple of weeks, a couple of months, or even longer. Adventure therapy can be something that's almost on an outpatient basis. There's adventure therapists where you meet with your adventure therapist and go for a walk. You meet and you go to the beach. You meet and you go to a climbing wall. They talk with all sorts of different people in this field. And it's kind of a cool podcast because you can sort of hear more about what's going on in the field. This is the UNH center that I talked about a little while ago, the Outdoor Behavioral Health Care Center. They've been around for a number of years. They do research into these programs. They got a decent-sized federal grant a number of years ago to do a comparative trial that actually compares outcomes with kids that have gone through wilderness programs versus kids that are in outpatient cognitive behavioral therapy. Unfortunately, they weren't able to carry through the study completely because none of the people that were assigned to outpatient therapy, none of the parents wanted to actually go through with it. Generally, when people get to the point where they think their kid needs to be in a program, outpatient is not enough. Obviously, outpatient has failed at that point. But these are some cool people that are really working to improve awareness of the field and safety in the field. So I think the outcome of my study overall is that the best thing that we can do in primary care to prevent our kids from needing these programs is to get them out into the woods. If the woods provide such a great benefit for physical health, prevention of cancer later in life, good, healthy social skills, and self-esteem, why not encourage that in the outpatient setting on a regular basis, as opposed to just after someone's reached the point where they need crisis level help? And that's sort of the gist of what I've taken from this research. And I do this in my clinic. When I have someone that has anxiety, one of the first questions I ask is, how much time do you spend outside? Do you go for walks? You know, how much do you sort of burn off some of that anxiety? Before I jump to a pill, I think anything I could do to avoid a pill is probably a good thing. We give too many pills in this field. I think nature can reduce the amount of pills that we need to give, not just in kids, but in all of our patients. And that's all I got. Yes?
First, thank you very much. And this may have been out of the scope of your research, but not too far from here, there's a riding place. Whose name? Back in the Saddle, Equine Therapy Center. My son didn't do the therapy riding, but he did do riding pretty much for like 4 years. And it was accessible. I think it's very accessible. That's just another component. Because in that hour and half of it was off the horse.
Yeah.
The riding part didn't come till later, but there was a lot of caring for the horse, of brushing the horse, of giving the horse the snack, of doing all the work in the barn. And I found it a huge stress release for him. Just as a point of information, it's not that far from here. I think they relocated a year ago. They're a little bit further. They're in Warner now. But that's in my role on the Healthy Beginnings. We've looked at programs to support that too. So that's kind of just a little FYI on that. But the equine therapy has been, and it's good because younger kids can participate and maybe not have to do a full residential experience, but it's there, and I think the benefits are pretty strong.
I would, and you're talking, they have both a therapeutic component and they have non-therapy. If you don't feel like you need therapy, you could just go there to ride, or if you need therapy, you can engage in a therapeutic component.
Correct.
I would consider that adventure therapy.
Right, and they have people who are specifically trained for those. They also work with veterans. They have a separate program for military veterans as well.
I wonder if I read about them in particular, because I did come across, I came across equine therapy and a couple other types of therapy that employed animals that really had good benefits for people with PTSD, including veterans. And I don't know if I came across them in particular when I was compiling research, I looked at a lot of stuff. But that's not the first I've heard that. But I would consider that adventure therapy.
Can you give us a general idea of the cost of one of these programs?
Incredibly expensive. Yeah, neighborhood of $600 to $1,000 a day. Yeah, yeah. There's and these folks that I mentioned, the outdoor behavioral health research folks over at UNH Dartmouth, a lot of the studies that they're publishing and the data that they're compiling is an attempt to get insurances to help cover these. If insurance will pay for a residential treatment center, they really should pay for alternative forms of treatment, and they're working to get that, to make that happen. Now, the program that I showed in Vermont is kind of interesting when we talk about payment. They are actually listed, and this is groundbreaking for this industry, and it's right in Vermont. They're listed as an in-network provider for Vermont Blue Cross Blue Shield. And you don't see a lot of that yet. Hopefully there's more of that to come with this sort of pilot program in Vermont. If people do well with it, other insurance companies in other states will probably be like, well, maybe we can save a little money and send a kid to Wilderness for 6 weeks as opposed to an RTC for 6 months. Oh, you're welcome. Thanks for coming.